Call on the member for Fredericton-South and leader of his party.
Thank you, Mr. Speaker. It's a pleasure to rise to respond to the Minister of Finance's budget for 24-25. Mr. Speaker, New Brunswickers, we're looking for hope in this budget, but what they got is despair. For hope, there needs to be concrete actions that you intend to take that are going to make a fundamental difference in the various crises we're facing in this province. But this budget fell far short. Mr. Speaker, a generational investment is required to address the massive social deficit successive governments have allowed to accumulate. Instead, we have a budget from this government that continues the status quo, paying for Band-Aids to tackle the problems of the 21st century. And we know what they are: the crisis in cost of living, the crisis in health care and senior care and affordable housing, and the havoc caused by our rapidly deteriorating climate. It's almost like this government's not been paying attention, Mr. Speaker. It's almost like, well, the Minister of Finance will appreciate this because he's a famous radio personality from days gone by. And in that era, I'm sure he played a couple of times songs from the album Crisis, What Crisis by Supertramp, which the album cover featured a gentleman laying on a chaise lounge surrounded by, well, the world breaking down. And I always wondered who that person was, and now I'm thinking maybe that's just the Minister of Finance laying there on that chaise lounge. Let's start with health care. Since being elected 10 years ago, Mr. Speaker, health care has been one of the most common issues that my constituents have brought to me, and certainly I've heard those same concerns routinely every time I travel this beautiful province of ours from corner to corner to corner to corner. We do need a generational investment to fix the health care system, as the New Brunswick Nurses Union, the New Brunswick Medical Society, and many of the medical and health workers associations and unions signed on to recently in their report and recommendations, where they proposed that an investment of $600 million was needed in this budget. Instead, this budget delivers less than $2 million more than was spent last year on health care. So those medical associations, those health groups, those professional associations and their unions, Mr. Speaker, for the first time in the history of New Brunswick, came together and crafted 6 recommendations for fixing the health care system. But this government wasn't listening. Let's see how the government's budget stacks up against what those in the system are asking for, are appealing for, are requesting to fix the system. They estimate that at least $70 million is needed this year to create enough multidisciplinary healthcare teams and primary clinics to shrink the waiting list for doctors. These clinics need to be rolled out around the province using both the community health centre model and the family practice model. $70 million, that they say, Madam Speaker. But what does the budget say? $20 million, not the $70 million requested. Dans le réseau de santé vitalité, le secteur des soins primaires pourrait être entièrement converti en pratique familiale en équipe, ce qui éliminerait la liste d'attente des médecins pour 56 millions de dollars. Que dit le budget? Zéro, Madam Speaker. Zéro. To stop the hemorrhaging of the healthcare professionals from the bedside and from doctors' offices, they recommend $192 million needs to be invested in retention and recruitment. In retention and recruitment, Madam Speaker, what does the budget say? Zero for retention. Zero for retention, and just $1.4 million for recruitment. Madam Speaker, healthcare workers are reaching a breaking point, with many leaving the healthcare system or for other provinces altogether due to inadequate pay, the lack of meaningful retention efforts, and the disrespect from their government. Un effort sérieux pour les retenir pourrait être financé sans même puiser dans le budget de l'année prochaine. J'ai demandé au Premier ministre d'utiliser son excédent de 246 millions de dollars cette année pour offrir aux infirmières et aux autres travailleurs de la santé des primes de maintien en poste. Il ne lui reste qu'une semaine pour utiliser cet excédent, alors je ne me fais pas trop d'illusions. He has just a few days, Madam Speaker, to utilize that surplus for the good of our healthcare system, Madam Speaker, because when we hit the end of this month, it's gone. Gone to bankers everywhere, Madam Speaker, not benefiting New Brunswickers. The Medical Society and the Nurses Union also called for $8 million to have patient discharge teams to do what? Have hospitals, those teams in hospitals 7 days a week to reduce delays and backlogs in emergency departments at admissions, which we know plagues many of our hospitals, Madam Speaker, leaving people to wait for 12, 15, 20, 24 hours, Madam Speaker. Some going home when they should not leave, when they should be seen, when they should receive care. And what does this budget say about that? Nothing. Rien de chose. Nada. There's no mention of any initiative to improve patient flows in our hospitals. Even to bring about the digital transformation of the healthcare sector that this government has said is their priority, $60 million needs to be allocated this year, according to the experts in the healthcare system. The Premier and Health Minister continue to say this digital transformation is important to them. What does the budget say? $22.9 million. Incredible. Madam Speaker, we have a healthcare system which often many in the system refer to as a sick care system, and point out that we actually don't have a complementary health care system. The former health minister made this one of the pillars of her white paper on health care reform, yet it's not reflected in the budget. The Nurses Union and the Medical Society recommended that $60 million be allocated for healthy living, preventative health care, and health promotion, a priority that the former Minister of Health had laid out in her white paper as well. But what do we get? Not 60 million, Madam Speaker, 5. And there was a tax, there's a tax planned for vaping. That's it. That's it, Madam Speaker. When we have such needs in this province around preventative health care and health promotion, we know we've got some of the highest levels of chronic health conditions, chronic illnesses in the country, Madam Speaker. Our social determinants of health are significant and creating ill health in many, many ways. There's so much to be done here. Environmental determinants of health, like radon gas in people's homes. 1 out of 4 homes have levels of radon that are posing the risk of lung cancer, Madam Speaker. This needs attention. Truly investing in health care, and we didn't see it. The Nurses Union and the Medical Society called for a 5% increase in the overall health care budget, and yet what we get instead is a 0.04% increase over last year's spending. What about the important area of senior care, Madam Speaker? We know that there needs to be more long-term care beds for seniors. Even with the best of home care, that would be the case. We need 500 new long-term care beds in the next year. That would cost around $160 million. What does the budget say? $18.7 million to continue the government's existing plan. Like the rest of this budget, keeping on with what they did last year, without recognizing that there is a need to step up and fundamentally address the crises we face. There's nothing in the budget to improve working conditions and salaries for nursing home workers who have been without a contract for over a year. Nor is there any discernible recruitment strategy for them. Les foyers de soins ont du mal à garder les aides à la personne parce qu'elles partent pour gagner plus d'argent en travaillant comme assistant d'éducation dans nos écoles. Que dit ce budget à ce sujet? Rien de spécifique pour les foyers de soins. Il en va de même pour la difficulté à recruter et à conserver des infirmières diplômées dans les foyers de soins aussi. Les agences privées de soins infirmiers les recrutent pour travailler comme infirmières itinérantes dans nos hôpitaux, moyennant une énorme augmentation de salaire. On my healthcare tour, at least the first leg of it, Madam Speaker, managers in healthcare in a seniors care home were telling me how they had had difficulty, as many seniors long-term nursing homes have, in recruiting registered nurses to fill 24-hour-7 requirement that social development has. They found a registered nurse, they hired that registered nurse, they trained that registered nurse for their nursing home, and then that registered nurse left, being recruited by one of the agencies to work as a so-called travel nurse just up the road at the local hospital. Because why? They could make a lot more money. Let me talk about personal comfort and clothing allowances. This is something many people don't know about unless they have loved ones living in nursing homes or special care homes. So if all of your income is going to cover the costs of your special care home or nursing home, you are given an allocation for personal comfort and clothing. It's supposed to cover anything else you need to spend money on. It's $135 per month for people in special care homes and $108 or so a month for people in nursing homes. It doesn't add up. Madam Speaker, think about what your costs are. Foot care is a common cost for seniors in nursing homes and long-term care homes. That can be $65 every time you get foot care, once a month. For over-the-counter medications, which are for seniors often numerous, $70, say, a month for over-the-counter medications. Well, just there alone, they've already spent the $135 if they're in a special care home and exceeded the $108 allocation in the nursing homes. So they haven't been able to buy a stitch of clothing. Madam Speaker, it's common, as I'm sure you know, for elderly New Brunswickers when they're in care with whatever conditions they may have, they lose weight. They lose weight, and of course, as they age, kind of shrink too. So clothing that used to fit you when you entered the nursing home doesn't fit you anymore. You need to have the capacity to actually buy new clothing that fits, including new coats for the winter, Madam Speaker, that fit. And that is common, and yet how could anyone pay for clothing out of these allowances? And that's not to mention the personal comfort side of it, paying for your internet, television, or phone, which I would say is not personal comfort, but kind of an essential service. So, Madam Speaker, these allocations should at least be doubled. But we didn't see that in the budget, not at all. The budget did include some improvements for home care, which I was glad to see, and related efforts to support seniors at home. $2 million budgeted to expand nursing homes without walls to additional 10 sites. This is a good initiative that came out of the work of Suzanne Blanchard at the University of Moncton with the help of the funding from the federal government for seniors pilot projects. I toured the initial location, Madam Speaker, at Port Elgin last month and was amazed at the work that nursing home without walls is doing to support seniors in that community. Very impressive. It's an innovative, creative program, if applied well, truly meet the needs of the seniors in the community. Can make a huge difference, as it is in Port Elgin. That program needs, of course, the resources to roll out province-wide. Also, thanks to the federal government's Aging with Dignity Fund, wages will go up for workers in home support and special care homes. It's impossible, really, from this budget to tell how much that will be exactly from a wage perspective, but I expect we'll get those answers, I hope, during estimates. Madam Speaker, food is actually one of the most important components of preventative health care. In the Nurses Union and Medical Society's report, they emphasized in their recommendations the need for the government to establish a universal, nutritious food program in all our schools as a cornerstone of preventative health care. And that's not the only thing they recommended, but that was the most significant thing in terms of cost. Because where is the best place to focus preventative health care, Madam Speaker? It's working with our young people in our school system where programs and initiatives can be rolled out in the schools, like a Universal Nutritious Food Program, like other educational and initiatives that will help young people learn lifelong practices and behaviors that will be good for their health and help them avoid disease and illness. Mon collègue, le député de Kent-Nord, a déploré que le ministère de l'Agriculture, de l'Aquaculture et des Pêches n'ait pas le mot alimentation dans son mandat. Ce budget montre encore une fois clairement qu'il nourrir les gens du Nouveau-Brunswick avec des aliments sains et locaux n'est pas une priorité pour le gouvernement actuel. Bien que le discours du budget du ministre des Finances dise que l'agriculture est importante, ce n'est pas en termes de son rôle pour assurer la sécurité alimentaire des Néo-Brunswickois, mais plutôt en termes de revenus d'exportation. Nous ne produisons que 7% des légumes que nous consommons, alors que le Québec et la Nouvelle-Écosse dépassent ce chiffre grâce à une production florissante en serre tout au long de l'année. Madam Speaker, we must establish food import replacement programs in our province to achieve the goal of increasing food self-sufficiency. I introduced a bill to achieve this during the Liberals' turn at governing in this House in 2015, and they voted it down. We need to adopt ambitious local procurement targets for public institutions, including hospitals, schools, universities, colleges, and long-term care homes, to prioritize the purchase of locally grown and produced food. Madam Speaker, this has so many benefits in terms of costs, in terms of health, in terms of environmental sustainability, in terms of supporting our local rural economies, Madam Speaker, supporting our farm families, that it is extraordinary to me that this, after almost 10 years, when I first introduced that bill, has yet to come to pass. Thinking about food, Madam Speaker, there's an increasing number of New Brunswickers who don't have enough money to put food on their table. This budget continues to force New Brunswickers who have to rely on social assistance to make ends meet, to live in government-enforced poverty, where day in and day out they're making decisions about what they can buy for food versus what paying their rent and other basic costs of living. Social assistance rates, despite the supplement that was added last year, remain far below what are needed to meet bare-bone needs. Il est temps de réformer le système d'aide sociale en garantissant aux gens du Nouveau-Brunswick en âge de travailler un revenu décent qui leur donne les moyens financiers de sortir de la pauvreté et de vivre dans la dignité. Talking about, Madam Speaker, the need to put in place a guaranteed livable income. I sometimes hear people say, well, a guaranteed livable income is impossible. Impossible to put in place. Well, right next door to us in Prince Edward Island, who have been working on this for some time, studying how to implement Canada's first such program, first guaranteed livable income in Canada over the past few years, has the support of all political parties in that province. And, Madam Speaker, they contracted with UNB economist, Fredericton resident, constituent of mine, Herb Emery, who has put together a significant, substantive, I would say groundbreaking report that proposes a realistic, concrete, practical plan to implement a guaranteed livable income on PEI. It's impressive. It addresses many of the issues that often are raised in a knee-jerk reaction to the concept of a guaranteed livable income. Addresses them well, intelligently, and effectively, Madam Speaker. It really is a kind of a roadmap to guaranteed livable income, which we could apply in New Brunswick. And Professor Emery is right here in Fredericton, not too far from the Legislative Assembly and Chancery Place, to consult with, Madam Speaker. Let's use him. And let's use more of our academics to help advise and develop effective government policy in this province. We have 4 universities, 2 community college systems, extraordinary scholars and students, Madam Speaker, who would be a tremendous assistance in helping us move more quickly into the 21st century to address the challenges we face. So, Madam Speaker, the proposal that Mr. Emery, Dr. Emery, was involved in developing on PEI would nearly eliminate poverty. Hard to believe, but really, as Martin Luther King Jr. said, what's the solution to poverty? Provide people with money. And this is what it would do, Madam Speaker. So, think of poverty. We also think of people losing their housing and ending up on the street, couch surfing, living with families, their family, or what have you, as a result of unaffordable rents. And we know, Madam Speaker, we say it time and time and time again, the single most important thing that this government can do to keep affordable housing affordable, which would not cost this government a cent from its budget, is to put in place rent control. The past year has shown us that the minister's alternative to a rent cap isn't working. It's more convoluted and less effective than a straightforward system of rent control. And Madam Speaker, as we proposed in our bill on rent control, if a landlord has additional expenses that would require them to increase the rent somewhat above the cap, we proposed a process for doing that. They make their case to the Residential Tenancies Board. Here's why I have to go a little bit above the rent cap. Here are the costs, and here's how much I would have to go above the rent cap, and they would rule on that. So this isn't a straitjacket, Madam Speaker, but it is a life jacket for people who have been having difficulty affording their rent and are potentially facing more and more unaffordable rent increases. Au-delà du plafond des loyers, ce gouvernement pourrait faire beaucoup plus pour créer des logements abordables. Je sais que pour ce gouvernement, le logement est une marchandise qui s'achète et se vend au prix fixé par le marché. Mais nous devons changer de mentalité et considérer le logement abordable comme un droit de la personne. This would require government leadership, Madam Speaker. We require government leadership, Madam Speaker, to create a boom in public, nonprofit, and cooperative housing to ensure that New Brunswickers have an affordable place to live. This requires that NB Housing Corporation, that's been stood up again on its feet, that it has sufficient funding to get nonprofit and cooperative housing built, but also to support and expand the number of these housing organizations across the province. We saw this happen the last time the New Brunswick Housing Corporation was in place, stood up, properly staffed, well-resourced in the 1970s through into the 1980s, Madam Speaker, and it worked well. And we see examples today right in my own riding, Madam Speaker, or adjacent to my own riding, I guess, right now. There's a housing co-op that was created, built in this way with the support of New Brunswick Housing Corporation back in the late 70s, early 80s. It's doing well, it's flourishing, and people have affordable rents there. It's a beautiful spot, Madam Speaker, a beautiful place to live, and that's what we need more of in this city and across the province. One of the things they don't understand, Madam Speaker, is why the province why this government didn't jump at the announcement that the federal government was going to remove the GST portion of the HST from the construction of new affordable rental properties. I was surprised that this budget doesn't remove the provincial sales tax for the construction of new affordable rental properties. Government keeps saying they want to see more affordable apartments built, and here is a sure way of helping to accelerate that construction. Last year, Madam Speaker, the Department of Post-Secondary Education and Training and Labour has completed stakeholder consultations on my proposal to ensure that all New Brunswickers have access to paid sick leave. While those consultations have been completed, I am disappointed the results have yet to be made public, and the government has not made any kind of commitment as yet to bringing amendments to the Employment Standards Act to guarantee paid sick leave to those New Brunswickers who don't have access to it. It's a question of fairness, really, Madam Speaker. We know a considerable number of New Brunswickers do have access to paid sick leave through their jobs or as a result of the good work of their unions to bring that about from their employers, but that's not the case for many other New Brunswickers. Madam Speaker, minimum wage in New Brunswick will go up to $15.30 an hour on April the 1st. Finally, Madam Speaker, minimum wage has passed the $15 mark, $15 per hour mark. Something, Madam Speaker, that I've been calling for since I was first elected in 2014. So we got there. It took almost 10 years. They say government moves slow, but that's a little bit too slow for people working minimum wage jobs. Le Conseil du développement humain a récemment calculé que le salaire de subsistance était de 24 $ à Fredericton, 23 $ à Saint-Jean, par exemple. Le salaire minimum de 15 $ était peut-être quelque chose de célébré il y a 10 ans, mais en 2024, il n'est pas suffisant pour empêcher les travailleurs néo-brunswickois de sombrer dans la pauvreté. We need to keep that in front of us all the time, Madam Speaker, that what is the actual cost of living, what does a living wage reflect, and thanks to the Human Development Council in St. John, we have that information on an annual basis presented in an excellent way that we can all digest, and that should be influencing our minimum wage policy. It's not. In the speech from the Finance Minister, Madam Speaker, the Finance Minister boasted about energizing the private sector, but lacked any details of how his government would help small business. And I've heard from small and medium-sized business owners about the difficulties they face keeping their businesses open and working. These businesses are the backbone of our communities, and that's why I support their call to decrease the small business tax rate to 1%, just as has been done in the PEI. This will also help them implement paid sick leave if they're currently not providing it, and perhaps help increase the wages they pay to their staff. The budget speech, Madam Speaker, addresses the issue of what this government is calling the clean energy transition. En regardant ce budget, on ne se douterait pas qu'il y a une crise climatique, alors que ce gouvernement parle de la nécessité d'une transition vers une énergie propre. Il mise une fois de plus sur les petits réacteurs nucléaires modulaires, une technologie qui n'existe pas. Il y a 12,5 millions de dollars pour subventionner la préparation d'un site pour un réacteur nucléaire privé qui ne fonctionnera peut-être jamais. Cette somme s'ajoute aux dizaines de millions de dollars que ce gouvernement a déjà injectés dans sa gouffre financier radioactif. Madam Speaker, instead of throwing money away on small nuclear reactors to benefit these private companies, they should be working with municipalities to help them benefit from inexpensive, waste-free green wind power and storage like the city of St. John is benefiting from through the Birch Hill Wind Farm, Madam Speaker, which we both attended the opening of the Birch Hill Wind Farm. Very impressive. What about rolling out the lessons learned from the 400 households that were enrolled and participated in the Shediac Residential Energy Study, Madam Speaker? The first of its kind in Canada, which was launched in 2018 and wrapped up this past winter. Among other things, this pilot project demonstrated how renewable energy can be integrated into people's homes and the provincial electricity grid in a way that brings value to New Brunswickers. There are thousands of New Brunswickers waiting to sign up for this kind of approach, Madam Speaker, but we're not seeing it. Once again, we've had a pilot project, a successful one, and we're not seeing it moved out around the province. The Enhanced Energy Savings Program and all of New Brunswick Power's energy efficiency programs need a higher level of funding. Energy efficiency is one of the smartest investments the government can make. Let's spend the money to clean up the waiting list and go after the rest of the eligible households for insulation and heat pumps. This budget only provides, well, less than half of what's needed to clear up that waiting list for this popular program, never mind recruiting new entrants. Meanwhile, there's no commitment to the long-promised financing for energy-efficient retrofits for moderate-income New Brunswickers. We need ambition to ensure that New Brunswickers can cut their power bills through energy efficiency improvements, through switching off oil heat to central heat pumps, getting off electric baseboards, Madam Speaker, to mini-splits and central heat pumps, to reduce their power bills. More important than ever, we don't see the investments that should be made through this budget. And what about tenants? They don't own the buildings they live in, and they can't influence really the heating costs, their power bills. So there needs to be an initiative that works with landlords to cut the heating costs for the tenants of those buildings, and there is nothing, indeed nothing, in the budget concerning that. Talk about affordability. How to pay for these vital climate change initiatives? Well, Madam Speaker, New Brunswick's Climate Change Fund has barely increased since it was first implemented by the government in 2018. And it's certainly not increased with the ambition necessary to meet the demands of the climate crisis. So, Madam Speaker, a report released yesterday by the Canadian Climate Institute found that the carbon tax on Canada's heavy polluters, heavy industrial polluters, is by far the country's most impactful policy for reducing greenhouse gas emissions. Yet this government has created a limp carbon tax for New Brunswick's heaviest industrial polluters compared to that of other provinces that lets them largely off the hook. A Green government would implement a made-in-New Brunswick carbon pricing system that will shift the pollution tax burden to where it belongs to the biggest polluters. We must ensure industry pays its fair share for the pollution it releases and use that revenue to help fund investments that protect communities and invest in the just energy transition. Instead of strengthening the industrial carbon tax, Madam Speaker, apparently this government, based on the motion they tabled, want to abolish it. Speaking of fair share, Madam Speaker, the corporate tax revenue continues to fall well below where it should be on the tax rate, and I see no movement in the budget on that. It's time, in so many ways, that profitable corporations, particularly those with windfall profits, pay their fair share of taxes. Madam Speaker, when it comes to the consequences of the climate crisis and severe and violent weather, we've got homes teetering on the cliff overlooking Carrigat Bay, horrendous erosion in Lugoulet, and the relentless storm surges undermining the main road on Grand Manan where it touches the sea. And we've got the Bay of Fundy knocking on Sackville's door. So where's the help? Revenue from a strengthened industrial carbon tax could help protect the people and communities of places like Grand Manan, Sackville, Lugoulet, and Carrigat. When it comes to the environment, Madam Speaker, we know a number of things. And one of them is there are a lot of issues and risks identified around the spraying of glyphosate. We know about the harm it can do, but despite all that we know about the harm it can do to health, forest ecosystems, and so on. The spraying continues. Despite all we know about the damage to biodiversity caused by clear-cutting and replacing forests with tree farms that then get sprayed with glyphosate, nothing is done. This budget continues to spend public money to spray glyphosate and facilitate widespread clear-cutting. What about contaminated sites? Nothing, Madam Speaker. We met with, at their invitation, the Mayor of Bathurst and a number of her staff, Madam Speaker, when they were in Fredericton the other day, talk about the contamination at the old Smurfit Stone pulp and paper site. The honourable member, the member for Bathurst, Beresford, has worked hard and long to try and move this government on this issue and getting nowhere. But it was striking to get down into the weeds a little bit and learn, Madam Speaker, about actually the state of contamination that they have uncovered on this site. For example, PCB contamination has even been identified on the old Smurfit Stone Mill property in 2 locations, one of the locations right near the beautiful Nipisiguit River. But all the people of Bathurst have got from this government is a shrug. Meh. Not acceptable, Madam Speaker. The best they've been able to do is to tell the city of Bathurst, you pay for it. Unacceptable. And Madam Speaker, when we're talking PCBs, we're talking dioxins. To say, you clean it up from the government, unbelievable. Old mining wastes, Madam Speaker, have ruined so many private wells in Minto, it's hard to count them. Where's the help for the people of Minto? They don't have a distributed water supply. They're all on private wells. The response from the government is, problem? What problem? We don't see a problem. Tell that to the people of Minto, who have to drive out of town to a spring along the highway to fill bales and buckets with clean, safe drinking water to take home so that they can avoid using the crap coming out of their taps. So, Madam Speaker, I want to address local governance reform. The budget speech was mostly silence on this, and we found out this week that the fiscal summit that was put on hold by the Premier, sort of the snap election in the fall, is not going to happen at all. So once again, this government has missed an opportunity to make structural changes necessary to make our municipalities vibrant. A top priority for me is to create more tax classes and untether heavy industrial property taxes from residential rates to help municipalities. But they need a new funding formula, a new way of financing their activities, Madam Speaker, and its budget doesn't speak to that at all. It's unacceptable the government has been downloading provincial responsibilities onto municipalities and expecting them to take those on too. Madam Speaker, New Brunswickers were hoping for a budget that would take the bull by the horns and fix the health care, build the houses, cut the power bills, cap the rents, stop the erosion, end the floods, and cut the crap. But all I got, Madam Speaker, were candy sprinkles. You know, the red and blue and green sprinkles that you put on cupcakes. I love them. I shouldn't, but I do. But it's like candy sprinkles on a slice of white bread. At first glance, those colored sprinkles, they look nice. They grab your eye. You go, I want to eat that. And then when you bite into it and you realize what you're biting into is just a piece of old, stale, white bread. That's what this budget is, Madam Speaker. No more. No one can live on that. And certainly New Brunswickers are not going to be able to benefit from this budget. New Brunswickers were looking for hope, not despair. This budget delivers despair, Madam Speaker. And our party, the Greens, will bring hope to this province. And we'll be talking lots about that this year as we move towards the general election. Thank you, Madam Speaker.
I recognize the Minister of Health.